Is our challenge capacity or is our challenge demand? What we find is that almost 100% of the people that come into the Team Training Institute say, I need more new patients. But when we do the analysis, we find that, oh, no, we just need to do a better job with what we have, right? We're out of capacity. We don't know it. And capacity blockages are sometimes hard or expensive to fix. But when you fix them, they pay for themselves really fast. And I have some examples of that. We're going to do a 4-step analysis of your practice, and you're going to do it. So we're going to go through first, we're going to go through appointment availability. So we're going to ask the question. This is the first step. We're going to ask these questions. Number 1, how soon can I get an appointment to get my teeth cleaned? This is any time, any day. This is not, well, somebody will fall off the schedule so we can put them in there. Nope, that doesn't count. It's a real appointment time. How soon can I get in? How soon can I get in if I have a tooth emergency? An emergency is defined by the patient, not by the practice. I was in one of my own practices, heard a phone call late in the afternoon, and the patient said, oh, this tooth's been killing me for 3 days, I want to get in. And the team member said, okay, we'll see you tomorrow. Oh, no. Why would you say that? Well, because it's been bothering me for 3 days. I'm not going to screw up our schedule because the tooth, no, right? We are there to help people. That's what we do. We fix teeth and people have teeth problems. That's kind of how it works, right? Next, when can I see a new patient? How far out am I booked? How soon can I see them? Next question. How soon can I have a 2-hour hygiene visit? Say we're going to do our periotherapy all in one step for one reason or another. Last one, we got a nice restorative case. How soon can we get a 2-hour doctor visit? And I know you're not looking at your schedules right now and you don't have them pulled up, so these are your best guesses. Remember, this is not depending on someone falling off. This is real appointments, real time. All right, so if your answer to any of these questions is more than 3 to 4 days, you have a capacity. Okay, and now, some of you, especially those of you who are new to us, are saying, holy crap, we're way out of capacity, right? Who's that in the room? You guys, great. You're going to love it here because when we're out of capacity, you are going to love it here. Dr. Nate, are they going to love it here? They're going to love it here. All right, so 3 to 4 days on any of these. If you're more than that, your capacity blocked.